Visit licensuraexams.com and try our samples completely free of charge.
Welcome to our licensure exam podcast. I'm Dr. Linton Hutchinson here with my co-host, Stacy Frost.
Hi there, everyone. Today we're going to be talking about the mental status examination, which is a structured assessment tool used to evaluate a client's current state of mind, cognitive abilities, and overall psychological functioning. We're focusing this episode on two specific domains that are assessed on the MSE: appearance and behavior.
Are those the only sections that are on the MSE, Stacy?
Oh no, there's several more domains, but we would be here for like a week if we if we tucked them all in this one episode. So we just thought we'd pick a couple for this one and do some more later.
Yeah, that's a good idea. We'll pick a couple others for another episode with a few case studies that demonstrates how assessing a client's appearance and behavior can help you determine the current mental state and aid in the diagnostic process and guiding the kind of treatment decisions that you make.
All right, so we'll start with appearance, which is pretty straightforward. You'll be making notes on the client's physical presentation, including their clothing, grooming, physical build and nutritional status, level of eye contact, gait and posture, and any physical abnormalities or signs of injury or maybe scarring. The client's appearance gives you valuable information about the client's overall self-care, physical health, and potential mental health concerns.
Mm-hmm. And this is what those signs might be telling you about the client, okay? If you see poor grooming or hygiene, this may indicate some kind of depression or neglect. It's sort of giving you, as you being a detective, it's giving you some clues to examine areas that you might want to explore. If the client avoids eye contact, what would that be? It might be a sign of anxiety. So that might be another area that you would attack. Alternatively, staring off into space or appearing distracted could suggest attention problems, disassociation, or even a psychotic disorder. If you look at them and you see visible injuries, this could be related to self-harm, abuse, or risk-taking behaviors that warrant further investigation.
Yep. And you can gain a lot of insight into a client from observing their appearance. Sometimes the clues are a little bit more subtle, though. So in addition to clothing, grooming, and obvious injuries or scars, you also want to pay attention to their dental health, their nails, and their skin.
Right. Missing or badly decayed teeth could be a sign of depression, where the individual even lacks any motivation or energy to attend the basic grooming and health needs. It could also indicate a more chronic pattern of self-neglect, possibly related to mental illness, substance abuse, or cognitive impairment. What kind of substance abuse might that be, Stacy?
I'm thinking methamphetamines. That one pops to mind most readily. Yeah.
Yeah. Me too.
Then there's also nail biting, skin picking, and hair pulling, which can be a sign of anxiety, stress, or even obsessive compulsive behaviors. Brittle or discolored nails could be a sign of nutritional deficiencies, poor diet, or even eating disorders. For example, excessive hair growth on a client's knuckles might be the first sign of a serious mental problem. Linton, I can see, let me see your hands. You're looking for it, aren't you? That's the second sign.
Man, you're such a trickster, Stacy. Aha.
I finally got you. Payback is such a witch.
Oh, yeah. Rich, I'm sure.
Hey, this has been slightly modified for the younger audience.
Oh, okay. Well, you just wait. You just wait. The podcast isn't over yet, buddy. Anyway, the MSE is all about gathering data points and using them to generate hypotheses, not making definitive diagnoses. If you notice something unusual about a client's nails, for example, it's an opportunity to inquire further with sensitivity and respect. You might say something like, I notice your nails look a little bit bitten down there. I'm wondering if that's related to stress, anxiety. Have you been experiencing anything like that lately?
Oh, you know what, Linton, now that you mention it, all this talk about nails has me looking at my nails. I know they're bitten down to the nubs, but it's from all that scraping of the 1980s wallpaper CJ and I are trying to get off while we're remodeling our office.
Uh-huh, sure, sure. And I suppose the scratches and cuts on your body are from feeding your chickens and stealing their eggs.
No, that happens when I don't give them enough treats. I get pecked.
Do you really?
So I do actually. Yeah, they're spoiled. They're really spoiled on mealworms and all kinds of treats. So yeah.
Okay.
Um, all right. So moving on. Here's a question I've got for you, Linton. All of
What?
us talk about, asking clients further information about appearance. Some clients might be a little bit more sensitive to you making observations about how they look. Even
Uh-huh.
if your questions are phrased what you think is in a gentle way, they might feel self-conscious, exposed, even get a little bit defensive. So how would you navigate a situation where the client seems uncomfortable with you saying anything or asking about their appearance at all?
Well, it's always, always important to consider the timing and the context of your questions. Instead of leading with questions about the client's appearance right off the bat, you need to wait until you've established some kind of rapport and trust with the client before you go that route. Another strategy is to use more general, open-ended questions that give the client space to bring up appearance issues on their own. You might ask them like, what have you been doing to take care of yourself lately? Instead of, I see you chewed your nails down to the nubs.
I'm trying to think of there must be some therapists out there who actually would say it that way. Who would lead with that as a comment?
No kidding. Can you say Albert Ellis? As an aside, he bluntly pointed out clients' irrational thoughts and beliefs sometimes, mostly all the time, in a confrontational manner. He used colorful, forceful language and didn't mince words. For example, he would tell a client that they were full of, let's say, rubbish. I remember going to a I remember going to a conference here in Orlando when he was the main speaker. And let me tell you, more than one therapist walked out on that lecture.
Oh boy, I bet that was quite an experience. Do you remember where he was from, Linton?
Yeah, I do. Well, he spent a lot of his time teaching in New York City at New York University.
I love your New York accent. It sounds a little bit more Bostonian to me. I know you spent some time up there.
Yeah, I did. Uh-huh.
Rather than focusing on quickly getting to the core of the client's issues using this sort of in your face type of therapy, I'd rather go on the Alfred Adler side of the spectrum here and use a more encouragement based approach to therapy.
Got it.
Where you work on instilling courage and confidence to make positive changes. But
You like
that is a whole other podcast. So we'll get back to some more ideas about what you can do if your client seems uncomfortable with being put on the spot with your observations about their appearance.
okay, okay.
You could, for example, explain your rationale behind asking about their appearance. So using the nail biting example, like we've been talking about, after validating their reaction, you might say something to the effect of, I'm sorry if my observations felt a little intrusive. I bring up these details because sometimes they can give clues about what you might be going through. Like if you're struggling with anxiety or depression that maybe you're not aware of. But I respect your privacy and your right to share what feels comfortable to you. Can you help me to understand what came up for you when I mentioned your nails?
Mhm. Yeah, that's a much softer kind of an approach, obviously.
Mhm.
Yeah. Okay. Now that you've got a pretty good understanding of what to look for when assessing a client's physical appearance, let's move on to behavior. When assessing behavior, you observe the client's actions, their mannerisms, and reactions during a session or the interview. On the exam, you'll be given clues to their presenting problems either directly through reporting the results of an MSE or your observation of their behaviors in the session.
Right. And you'll be documenting their level of cooperation. So, are they cooperative working with you? Are they hostile? Or are they maybe more guarded? And their psychomotor activity, which means their level of physical activity. Are they pacing around your office? Are they fidgeting with their hands and they're having a hard time staying seated? Or are they so tired that they're nodding off in the middle of the interview? Are their movements noticeably slow? That type of thing.
So, just like with appearance, your observations of behavior can provide valuable diagnostic clues. For example, if a client frequently figures and taps their foot or wrings their hands, they may be experiencing anxiety. A client with depression might exhibit slower movements and appear real lethargic, slouching in their chairs and speaking real slow. And a client with a history of trauma or PTSD may appear hypervigilant or easily startled during the session. They could have difficulty relaxing and instead maintain a rigid posture or appear always on guard.
Those are great examples. Of course, it's important not to jump to conclusions based on appearance and behavior alone. You need to integrate those observations with the full clinical picture. And it's important to interpret behaviors within the context of the situation. So let's say Clinton, not related to anyone in this podcast.
Sure.
Clinton comes into your office for his Wednesday appointment. It's pretty close to lunchtime. He usually chooses a time slot later in the day, but this is the only opening that you had. Now, you notice that Clinton seems a bit distracted and he's eager to wrap up this session before it even begins. Well, before diagnosing him with ADHD or bipolar disorder, you'd want to consider that he may simply be hungry, distracted, and thinking about his meal. It is, after all, Wednesday, his favorite BOGO public sushi day.
And you know, Kai will always give me a second helping of wasabi. Right. But make sure to consider the duration of the client's behavior over time. For example, if Tracy, not related to anyone here, Stacy, your next client comes in after lunch, where she has just finished stuffing her face with sauerkraut, washed down with a few pints of Beck's beer, that very well could be the reasons why it's hard for her to respond or think of anything else. But if Tracy consistently shows difficulty focusing, appears lethargic, or was easily distracted from the topic at hand, that behavior would be more clinically relevant if it persists from session to session. In that case, you might explore if she is experiencing underlying anxiety, ADHD symptoms, or some other issue interfering with her attention and engagement.
You know, Linton, all this talk about sauerkraut really has my stomach rumbling. So how about we do a quick summary of what we've talked about, and then we get off to eat our lunch. When assessing appearance on the MSE, we observe the client's clothing, grooming, hygiene, physical build, level of eye contact, facial expressions and posture, and any visible injuries or abnormalities. And these observations can give us clues about the client's self-care, their physical health, and potential mental health concerns. Now, it's important to pay attention to real subtle details too, like dental health, nails, and skin, as these can also provide insights into the client's overall well-being and functioning. When asking about sensitive appearance issues, it's crucial to establish rapport, choose the right timing, and frame your questions gently and with empathy. Open-ended questions about self-care can invite reflection without putting the client on the spot.
And in terms of behaviors, we observe the client's actions, mannerisms, and reactions throughout the interview. This includes their level of cooperation, psychomotor activity, impulse control, and ability to regulate emotions. Your observations can provide valuable diagnostic clues, but should always be interpreted in context of the client's full presentation and circumstances.
Exactly. And one more thing before we go, you want to make sure that you're taking your client's cultural background into consideration too. I know we mentioned eye contact, and sometimes kind of decreased eye contact can be a sign of anxiety. It could also be a cultural, there could be a cultural explanation for those kinds of behaviors.
And as you study for your exams, remember,
it's in there.
It's in there.